Hello, Facebook world. Hello, hello, hello. On our first Rehab Thursday of April. Thank you so much for tuning in. Please, when you jump into our episode today, please make sure that you um, leave a comment so that I know that you're here. I really want to know um, who's joining me, and if you have any questions, you can always type that in throughout today. And if you're catching this on the replay, please type in replay or you can put hashtag replay again so that I know that you were here and let me know if anything I said today can benefit you. So come on in. If you're watching, make sure that you tag a friend, call a friend, whatever you need to do to get them on today. This is an episode that you don't want to miss. Not that you want to miss any of them, but today you definitely don't want to miss our episode. All right. So, thank you again. Welcome to Rehab Thursday. It is live with Dr. D, and I am your host, Dr. Dewan Carpenter. I am a board certified physical medicine and rehabilitation physician, which means that I am focused on improving your function, improving your quality of life, despite any conditions related to your nerves, bones, um, brain, spinal cord, any of those conditions that may be affecting you. We're going to help you work through those. All right. I have to take a moment and say happy National Occupational Therapy Month. Is this month April starting off, and I know some wonderful occupational therapists, and I have to say I could not do my job without them. So I really want to give them a shout out and hope that they have a wonderful month this month. Because they're doing some amazing work. And for those who don't know, in the event that you're just joining me and you don't know what occupational therapist does, essentially occupational therapists, they focus on improving the activities of daily living, or ADLs, and those things include feeding, dressing, bathing, toileting, and grooming. All of those major things that you do every day on a daily basis, probably without thinking. An occupational therapist helps someone who has lost the ability or has a decreased ability to do those things. Alrighty. So, today our topic is I've fallen and I can't get up. I don't know if many of you remember that commercial. I forget exactly what it was for. Maybe it was the Life Alert. But there was a commercial that had an older lady, a more mature lady, who had fallen and she could not get up. And so that was the thing that she said. You see her on the floor in what appears to be maybe her living room, and she says, I've fallen and I can't get up. So today we're talking about 5 tips to prevent falls at home. All right, very important. And why this is important is coming up literally in 2 seconds. I'm going to tell you why this is so very important. So I'm going to give you some statistics just to put this all in perspective, okay? This information comes from the National Council on Aging. 1 in 4 Americans that are 65 and older falls each year. So we're talking about at least 25% of people 65 and older are having a fall per year. And every 11 seconds, an older adult is treated in the emergency room for a fall. Every 19 minutes, an older adult dies from a fall. Falls really are the number one leading cause of fatal injury and the most common cause of non-fatal trauma-related hospital admissions in patients 65 and older. Even more staggering actually is that falls result in more than 2.8 million injuries in the emergency department per year, and over 800,000 hospitalizations and 27,000 deaths. Okay, we're talking about per year. That is a lot from a fall, which most of the time can be prevented. So that's what you're gonna learn here today. Um, Now, in 2015, they estimated the total cost of all fall injuries was about $50 billion. 50 billion. B, B, B billion. All right. And really, they expect that um, the financial aspects of this will increase most likely to 67.7 billion by 2020. So, that's just next year. 67.7 billion dollars from caring for individuals that have fallen. All right, so like I said, that is the statistics from the National Council on Aging. This is why it is very, very important. I'm telling you, I see a lot of people that have multiple injuries from falling. And again, most of the time, those falls can be prevented. So let's get into it. 5 tips to prevent falls at home. And again, if you're just joining, make sure that you tag somebody, share this to any of your friends, family, loved ones that may be able to benefit from this. All right. So the first tip is make sure that you review your medications with your doctor. Why? Medications have side effects, right? And there are a lot of medications that are increase a patient's risk for fall, particularly if they are 65 and older. So there's actually a list of medications called the Beers list that goes over the medications that should be either avoided completely or used, with caution, when they're absolutely necessary. And so I would encourage you to make sure to mention this to your doctor, that, especially if you have had multiple falls in the past, you need to make sure that you go over your medications with your doctor. Have a medication list, so that your doctor, your primary doctor, and any other specialists that you see are able to stay updated on what medications that you're taking, so that they're not putting you on medications that may interact with each other and increase your risk for falls. Okay. I will tell you one that I see very, very often in the population 65 and older is patients that are taking benzodiazepines for anxiety or sleep. Those are medications such as Restoril is used for sleep often. Things like Ativan, Xanax, and Klonopin. There are a lot of people over 65 that have been taking these medications forever. Okay, the medication is a sedative hypnotic, which is why it is used in sleep, because it does make you very drowsy, at least most people. But the risk is that if you get up, after you have taken that medication, the sedative part of it is still in your system and can make you very drowsy. It can make you dizzy and off balance, particularly if you're already that way. Okay. And so that is one of the medications that increases your risk for falls. It also increases your risk if you are taking narcotic medication on top of that. Okay, so again, talk with your doctor. Let me also put this disclaimer out. This is not medical advice. I am not your treating physician, so make sure that you contact your treating physician in your treating physician's office before you stop any medication. Call your doctor first, okay? So what I'm telling you to do, first tip, is to review with your doctor your medications. All right. Number two, fall proof your home. So many of you have heard of baby proofing your home, but you need to fall proof your home as well. Again, a lot of this is, pertains to people who are 65 and older. But if you are the caregiver of someone 65 and older, this is still beneficial. And you can always do this in your own home as well. You don't have to be 65 or older. But fall proof your home. So it is, kind of similar to baby proofing your home, in the sense that you want to prevent and get rid of anything that may increase your risk for fall, especially if you're in a hurry. Most falls actually happen in the middle of the night. It is very common for people over 65 to have to go to the bathroom multiple times at night. So now we have having to go to the bathroom. So there's an urgency there where you want to make sure that you get there. There's darkness that plays a factor, and potentially balance plays an issue. So in order to combat that, make sure that there's floor lighting on the pathway from the bed to the bathroom, so that if there is anything that happens to be on the floor in the way, you won't trip over it. So floor lighting. Make sure that all rugs are removed, particularly if you have to use something to help you. So like a cane or a walker or crutches. Rugs are known to be something that people commonly trip over. Okay. If you do use a cane or a walker, make sure that it's in reach. Okay. It doesn't help you. It doesn't assist you with ambulating if it's all the way on the other side of the room. So make sure that your walker or your cane is right by your bedside. Okay. So that you can get to it with no problems, and don't have to stretch or reach, and then again putting yourself at risk for having a fall. Grab bars, having bars in your bathroom, having bars kind of on the way to the bathroom, so that if you do get a little off balance, you have something to hold on to, so that you're not going down basically. And if you go to the bathroom frequently in the middle of the night, maybe consider a bedside commode. That is, literally just a toilet seat that is next to the bed, so that you don't have to, make the trek all the way to the bathroom and potentially fall. Something else that I would encourage you to think about is think about getting something like a Life Alert, or I don't know what the other brands are, but there's tons of others out there. And my other disclaimer is I don't necessarily endorse any product. I don't have any financial ties to any of these products. But, especially if you are 65 and older, or someone 65 and older who lives by themselves, and particularly has had falls in the past, make sure that they have some way to contact someone. So I've seen people with a Life Alert button. I've seen people with a cell phone that they actually wear around their neck at all times, so that they will be able to call for help. Because the other thing that you don't want to happen is to have a fall, and now you're laying on the floor and literally can't get up. And who knows when someone is going to come to check on you, and you're laying on the floor. So that puts you at risk for other things, basically muscle breakdown from being on the floor. Then that can cause kidney problems. It just spirals out of control. Okay. One other thing, and this is not telling you to get rid of your pets, but I have seen many people fall over their dogs or cats. So that's another thing that maybe if your dog does not have training, maybe you can train the dog, or get someone to help you train the dog or cat. I don't know how cat training goes, but can get you to train them, so that they know if you're getting up at night you know, that they're positioned in a certain place, or you crate them at night, or whatever the case may be. Or even just don't try to step over the animal, because there's been a lot of people that have fallen trying to step over them and that kind of thing. So the second tip is fall proof your home. The third tip I have for you is get your balance checked. You know, routinely, you know, maybe at your annual physical, you can ask your doctor to check your balance, make sure that your balance is okay, because that is one part of one contributing factor if you have poor balance. But the other is, you know, having a yearly hearing and vision test. And the reason for that is really your balance is tied up in kind of three things. So, proprioception, which is your ability to feel your body in space, and the vestibular system, which involves the hearing and balance centers, which are in your ear, and then your vision. So if you take one of those components out, you are at increased risk for having poor balance. So proprioception, a good example is people that have lost sensation in their feet for whatever reason. In the United States, the most common reasons are diabetes, uncontrolled, and alcohol abuse. So if you don't have the ability to feel your feet in space, particularly if you're getting up in the middle of the night going to the bathroom, you're not really going to be able to feel the floor and feel things around you. It increases your risk for falling because your balance is now going to be compromised. The vestibular system. So if you have problems there, even with either with the hearing or with the balance centers in your ears, again, you have are more likely to have some dizziness, possibly with position changes and things like that, which can get you off balance and cause you to be more likely to have a fall. And then obviously vision. You got to be able to see where you're going, and you know if there's something in your pathway that you may step on, and so that is a major component to your balance. Okay, so tip number 3, make sure to have your balance checked. Tip number 4 is make sure to talk to your doctor if you have symptoms of dizziness upon standing, or dizziness when you go from lying down to sitting up. That would be called orthostatic hypotension, or at least symptoms of. And that is when your blood pressure essentially doesn't catch up when you change position. So there should be a natural adjustment in your blood pressure when you go from lying down to sitting, and from sitting to standing, or from lying to standing. And if your blood pressure drops when you go from sitting to standing, that is called orthostatic hypotension. And it will cause you to get dizzy. So you've heard people say, oh, wow, I'm dizzy. Oh, you can ask them, what happened? Oh, I just felt real dizzy when I stood up. I just stood up too quick. Well, yes and no. You didn't necessarily stand up too quick. It's that your blood pressure or your heart rate did not catch up in time as you were changing positions, because it's positional related. Okay, and you're at an increased risk for that over 65. And if you are dehydrated, and not even just like clinically dehydrated, if you are not having enough fluid intake, which, sometimes people who are retired, they don't really keep track of what they're drinking. And so you can have that as a potential issue. So talk with your doctor if you are having any dizziness when you change positions, because it may be a sign that you have orthostatic hypotension, and that needs to be treated. Tip number 5 is get active, move more. Again, this is probably a running theme in almost all of my videos. You gotta move. Move, move, move. So get active in activities, but specifically in activities that increase your balance and mobility. So some good activities that won't put increased strain on you and things like that are Tai Chi, which has been very good for people who are 65 and older and want to stay in shape. Also, yoga is a good activity. It helps you to work on your balance. It helps you to increase your flexibility and mobility. And it may also, help you stay very relaxed and, just kind of in a very pleasant state. So multiple benefits there. Your local area on aging is a good resource for you or someone you know. They would be able to give you some very good and very vital information on places and on the offerings that are in your local area. All right. The other thing too is silver sneakers, which a lot of the insurance plans will allow you to join. It's called silver sneakers, and you can go to a gym. Usually it's free or very very reduced cost, and you're able to basically have all the benefits of a gym membership to help you to increase your mobility and increase your fitness. And they most likely have some sort of yoga or Tai Chi or multiple classes that you would be able to take. And then you also can meet other people your age, other people in your area. And now you've also, you've worked on your health, you've worked on your fitness, your flexibility, and you're working on your social skills at the same time. So it's a win-win. And so number 5 tip is to get active in activities that will increase your balance and mobility. And bonus number 6 may sound crazy to you, but learn how to fall. I know it sounds silly. I know it sounds stupid, but there is a right way and a wrong way to fall. Okay. So obviously, there are some things, despite all of these tips, that you may not be able to do anything about, or your loved one may not be able to do anything about. But if you know the right way and the wrong way to fall, at least if there is a fall, you can minimize the injuries and minimize the effects. Okay. So one thing that people commonly do is if they're going to fall forward, they put their hands out. And my hands look really big on that screen. So they put their hands out in front of them to catch themselves. It's instinctual because you're trying to protect yourself, really mostly protect your brain, protect from hitting your head, right? In the process, you sacrifice your arms and possibly your legs. That's not a good thing. I mean, in the sense of, obviously, you don't want to fall and break anything. But the right way is really like a tuck and roll, okay? Because you want to protect, your limbs, protect your head and all of that, so that you minimize the injury that you may have if you do go down. Places actually have things that hold on to you but allow you to go down in a safe environment where you will not get hurt, but you know that feeling and you can practice what you need to do to minimize injury. So that's something also that's worth looking into. But just remember, if you do fall and you don't have a place where you have practiced, tuck and roll is going to be the best thing. Okay. And one other thing that I failed to mention is so a fall by itself does not necessarily mean that you will be injured. However, in people 65 and older, you are more likely to have osteoporosis, which is thin, brittle bones, which means that even the slightest, most minor injury can result in breaking bone. Okay, so that's why it's important to really try to prevent any falls if at all possible. If you have a family member or a loved one or a sibling or grandparent or whoever that lives at home, and particularly if they live by themselves, it's very important for you to monitor them, check in on them frequently, and make sure that they're doing okay. And most people do not know that they are a fall risk. And around their friends and family members, they will minimize the risk so that you are not concerned, because again, as people age, there is some fear there about losing their independence. So if I tell my family that I've fallen several times, they're not going to allow me to live by myself, or they're going to take away the keys, or I'm going to be just stuck in my house. And obviously every family is different, so I encourage you to have a discussion or a family meeting about it. But the biggest thing is going to be safety. I read to you the statistics. 1 in 4 Americans 65 and older falls every year, and every 11 seconds an older adult is treated in the emergency room, and every 19 minutes an older adult dies from a fall. So in the time that we have been talking today, there has been an older adult that has fallen and died as a result of that fall. That is one too many when this could possibly be prevented. Okay, so make sure to have these conversations with your family members. When they don't think that you're watching, make sure that you watch how they're walking and how they're doing things and how they're really getting around, because again, the majority of these falls and deaths are preventable. Okay, so let's just recap. The 5 tips to prevent falls at home include: number 1, reviewing your medications with your doctor to make sure that you are not on medications that increase your risk for falling. Number 2, fall proofing your home. Getting anything that could potentially increase your risk to trip and fall, get it out of your home. Number 3 is make sure to have your balance checked, and along with that, get yearly hearing and vision tests. Number 4 is if you have any symptoms of dizziness, particularly when you change positions, make sure to get that treated. Number 5, get active in activities that will increase your balance and mobility. And, again, use your local area resources. So the local area on aging, and you can also go to the National Council on Aging, and it will help direct you to local resources in your area. So today, that is our Rehab Thursday, is preventing falls at home. I gave you 5 tips, and the bonus tip was learn how to fall with minimal injury. All right. Please, guys, tag someone, share this video. I'm telling you, I see a lot of falls, and this is a big issue. Okay. So let's make sure that we spread the word so that we can help decrease the number of falls in our friends and family 65 and older. All right. So this has been our Rehab Thursday edition, and I have been your host, Dr. D. I'm a board certified physical medicine and rehabilitation physician, and I am here to help you and your loved ones live better, live longer, and be better. All right. You have one life to live. I want you to make it count. So make sure to share this video, like my page, and get notified when I'm live. Next week, we will be here on Thursday at the same time. So make sure to tune in. Thank you so very much for joining me. I really appreciate everybody that tunes in every week. I can't say that enough. Um, Please make sure again to comment so that I know that you were here, especially if you're catching the replay. If you have any questions or you have any topics that you would like for me to cover, please send me a note. I'd be happy to go over it. Okay. All right. So I will catch you guys next week. Make sure you live your life to the fullest because you only have one. All right. Take care. See you guys next time. All right. Bye bye.